It has been a year, and the signs of pandemic going out from our lives look gloomy. Although most of the countries have started the vaccination program, but the idea of back to normal is still far behind. The pandemic has hit the world so hard that the world economy is in total disarray. Almost all the countries in shambles, especially the Latin American countries. The region is facing a grave crisis. From rising COVID cases to the shortage of vaccines, the pandemic has hit this region very hard.
So, Dr. Arnab, before we start our discussion on the Latin America, let us know what is the current situation of COVID in Latin America there, and what are the current challenges in front of the governments right now?
Well, if you see, historically, that place has always been at the beating end, unfortunately. Uh, Colonialism, and then you had this patron client relationship. Okay. And of course, during the Cold War, as we all know, both the Soviet Union and the United States were always vying for influence in the region. We know about the Cuban Missile Crisis and the various coup and all those things, Augusto Pinochet, and all those things we know about that. But currently, if you see, the pandemic actually made the matters even worse. It has made the matter worse for all of us. But for Latin America, it has made it even more worse. Now, if you see, Brazil, Colombia, Argentina, Peru, Mexico, and Chile, they have been the worst hits. In terms of the fact that the IMF actually say that there is a contraction of 8.1% of the economy, 8.1%. Now, previously, prior to the pandemic, it was supposed to grow at 1.8%, but now there is an 8.1% contraction. Its supply chains are completely distorted. It has only 8% of the world's population, but 28% of the cases and 34% of the deaths. So you can just see 8% of population and the deaths are 34%. Now the lockdowns that were enforced, as in all over the world, even there, the lockdowns are basically a choice between saving the economy and saving people. It was the choice was between that. So they had no option. They went for a lockdown and all. Because of which 60% of the workforce got laid off, unfortunately. The remittances, because especially Central America and parts of Venezuela, exactly, yes, those countries that depend a lot on foreign remittances. You see all these Latinos, they go to the United States and parts of Europe and they work and they send back money. It happens with all these people. But that things got delayed because even they got laid off. Because see, if you observe in a way, we are in a globalized world. The economy is very globalized. There is a demand and supply. Like for example, the clothes you're wearing, the material might be from Cuba, for example. It might be made in Bangladesh. The company might be American, and we Indians are buying it. So if one point at one country, if there's a problem, it distorts the entire supply chain. So that is what has happened. The tourism sector was very badly hit because they depend a lot on tourism. That was badly hit because basically, if you have a lockdown, if you don't allow flights and all people to come, your tourism is gone. And now there has been a shift in the global consumption patterns. The demands were reduced. Because as I'm saying, since we are in a globalized economy, you depend on each other, the demands are reduced, as a result of which the consumption patterns changed. So if the demands are low, the supply is also automatically unable to keep up with it. And as a result of which they started to lose money. One more thing that actually happened was that the Latin American countries are mostly depend on export of raw materials. Even if you see, like Brazil, for instance, exports 80% of its soy crops and other allied products to China. They depend on all these things. But the over dependence on China has increased. Because if you see very carefully, it is only the People's Republic of China which has actually come out strongly from this entire pandemic. First of all, the virus came from there, and there are speculations, there are elements, and like it's a open, it's a clandestine kind of a biological warfare. So they made their economies fine, they improved. But the Latin American countries, the dependence on the People's Republic of China is even more. The second thing is that the situation right now is that there's a very slow vaccination drive. Very slow, to be honest, very slow. That is a problem. Now, there are other issues like you have a requirement for lockdowns because suddenly we feel that, okay, this pandemic is more or less over. We were also feeling like that. They also felt the same way. But suddenly you have mutations, you have new strains. So again, the discussions of lockdown. Like, let me say, recently Costa Rica said, okay, we're going to open land borders also for tourists to come. Certain restrictions are there. Now they're again contemplating on closing it down because again, mutations may come. Small countries, very less populations, in that way. So if one person gets infected, it infects almost everybody out there. And as a result of which, the dependence on PRC is increasing, which is very bad in a way because the Chinese, the People's Republic of China, they actually have a very predatory attitude. So they are already buying a lot of companies. They are actually inserting capital, yes, but it's very opaque in nature. And because of the predatory nature of the Chinese, this will be very bad in the for the Latin Americans in the longer run, because Europe is almost finished and the United States is also struggling. Even we are also struggling. So they have no way but to look up at the Chinese. So the situation as of now is very grim.
Um, as we talk about the pandemic, doctor, like several countries right now are ailing from the economic problem, and we know that this region is quite. There are lots of economic disparity. So, how tough the lockdown went? Like we all know, in our situation in India, it hit a lot of people. So, how the tough was lockdown in this region, and the post lockdown, how was Latin American economy is now performing.
See, if you ask me that way, prior to the lockdown, the economies, I won't say they were doing very well, but they were recovering. They have a age-old problem of depending on foreign capital, a debt structuring program, a very high debt to GDP ratio that has always been there. Apart from that, the health crisis is always there. It has always been. The infrastructure is terrible. Let's say that way, it's terrible. In addition to that, they have always played second fiddle. You see, Latin America has never found its identity in a way. Let me put it this way: either it's the US or the dependent Soviet Union. So when Soviet Union, it got dissolved, then they were dependent on the US. Of course, there were issues also with that. Then they started depending on the European Union, and now China. So as a result of which, they never found their own identity. For an economy to grow, if you see India's case, we liberalized in 1990s. We started making things on our own. We tried our best. Out there, they could not do that because number one, you have a very huge amount of inequality. A lot of poverty is existent that you cannot deny. Coupled with that, you have a very large presence of indigenous communities in certain countries like Bolivia, Peru, Venezuela, Guatemala, Colombia, Brazil. If you have a lot of indigenous people, these people are again very different. Historically, they have faced the worst. Due to colonialism, the post-independence era also, they were never given their due. And unfortunately, if you see, the pandemic has made things even worse. So if you compare with India, we have something to fall back on. Why? Because number, when you have a diversified industry, diversified economy, let me say, we have tourism, we have a very vibrant private sector, we have a very vibrant services sector, telecom sector. So we have something to fall back on. What do they have? They have to depend on extraction and sale of resources, which again causes problem with indigenous people in many parts. That's first thing. Second thing, mostly dependence on raw export of raw materials. Third thing, a very weakly diversified industries. So as a result of which, let me give an example of a country like Venezuela. Okay, in Venezuela, as long as the oil prices are high, that is what you know as the Dutch disease or the resource curse. As long as the oil prices are high, the Venezuelans are making a lot of money. They had massive subsidized programs. Things are really good. The moment the oil prices started to dip in 2019, it went even bust completely. Then they have no more money to finance all the social spending. And as a result of which, now you have the pandemic. I'm just giving up one example of one country. You have this pandemic, which has even made things worse. So when you compare with India and Latin America, we are quite different in this asset. We could take it. We could take it. They unfortunately cannot take this thing anymore. Again, they'll depend on foreign capital. Again, there'll be structural adjustment programs, unfortunately. And then you have predatory countries like China, always ready to make something out of this kind of situations. So as a result of which, the situation is really grim out there. Even now, it's even grim.
If we talk about the health sector, like according to Pan American Health Organization, somebody sent me right now, Latin America does not have enough vaccines, and in the region, as you all know, the cases are increasing day by day. So, will it be true to say that the region's healthcare system has been unable to cope up with the pandemic?
Historically, again, when you talk of Latin America, if you take economy, if you take the social structure, then obviously the health sector also falls in that. That also has its own share of disparities. Primarily, the WHO, for instance, has said that around 700 million of the people out there need to be vaccinated to at least come to the stage where you can say, okay, we can override this situation. The first problem that happens is the basic health structure is very poor out there. They have their diseases. like we're a tropical country, they also are a tropical country. So you have all these kind of, vector-borne diseases, plus you have other kind of issue syndromes like obesity and diabetes and all. So the hospitals are already understaffed. That's the first thing. Universal healthcare is there, but let's say 16% of the states dedicate only 4% of the GDP to healthcare. That is a problem. The largest vaccination drive is actually happening in countries like Chile, Uruguay, Antigua and Barbuda, Dominica and Barbados. But other states like Brazil and all, Mexico, they're falling short because of the large population. So first problem that happens is the acquisition of vaccines. Now, when you have to buy expensive vaccines, then again, the question comes, how will you finance it? First of all. Second thing, forget about the vaccination part. Let's talk about simply the health sector. Understaffing, lack of basic medicines, the fact that hospitals cannot cater to all the people. There are many communities which are far off in villages and towns from, you don't have access to the health sector, the hospitals as well. In addition to that, 1 in 3 people, okay, almost 1 in 3 people, they don't have access to universal healthcare. And 70% those who live in extreme poverty, they have no access to healthcare at all. So if you see, the problem is very structural in nature. You have lack of access, lack of medicines, you have very understaffed hospitals. The financing of hospitals is very weak in nature. That's always there. And as a result of which, what happens when you have a pandemic, it actually makes the problems even more complicated. So I don't see any like quick solution out of this. I really don't see, because the main problem that happens is financing. I mean, how would you finance all these things? But somehow or the other, the first priority for them is to ramp up the vaccination drive. That's what I personally feel, that they need to ramp up the vaccination drive so that at least they can have some safety. Otherwise, things will really get out of control.
Okay, this question is related to Venezuela. Like, as we know, in mid 2019, we saw thousands of Venezuelans left their homeland and they just walked down to their neighboring country's border and just across their borders and started living there. And as the lockdown was imposed in these countries, we saw that they just walked back again to their country borders, like just like what happened in India. Like most of our the unfaithful incidents we saw in the news, like many migrant laborers has to walk. So how this pandemic has affected the Venezuelan migrant, as you have already said, the foreign remittance has been decreased due to the pandemic. But what are the other factors which has affected them?
See, as long as Hugo Chavez was in power, there was a charisma. He had his own leadership skills, and he could manage things quite well. Plus, the oil economy was really working well. The money earned from oil was really working well. Now, that is the unfortunate situation with a country like Venezuela. They depended on only one product. Now that product loses its value in the market, so the finances stop coming. And then, unfortunately, Hugo Chavez, he passed away, and Maduro inherited a very fragmented political structure, unable to deal with it. Then you have Juan Guaido, the opposition leader who called himself president. He was vehemently supported by former president of the United States of America, Donald Trump. And then you have this migrant crisis. This migrant crisis was happening before only. The pandemic, as I'm again saying, just made it even worse. This was happening before only. People are going from Venezuela to other countries because you have no jobs, you have no access to sanitation, healthcare. Basically, life is really hard out there. So they started going out. Now, what happened when they went to these countries like Colombia, Brazil, or Peru, and all Bolivia, and they started settling there? Now, when the lockdown started coming, now they became virtually stateless because the governments of those countries, they did not want to accept them. You are not our people. You should go back to where you came from. We can't give you healthcare. We can't give you any kind of cash help or something or the other. Even Ivan Duque, the president of Colombia, and the Venezuelan president Maduro, they had an exchange of words. This happened. Now the problem of the migrants is just like in India. It's something exactly as you've pointed out quite correctly, just like in India, but that is within the country. This happened because this happened in a transnational way. The migrants were forced to go back to Venezuela. Now, when they go back, first of all, they have to deal with a lockdown. Secondly, they have to deal with sanitation. Third, they have to deal with the border patrols. Fourth, they have to deal with drug cartels. And fifth, they have to deal with the touts. The agents will say that we will sneak you through the border. You don't have to go for testing and all. Now, even if they have crossed all those hurdles, by the time they come to Venezuela, what do they see? No jobs, no sanitation, no access to healthcare, almost stateless. So life, if it was bad in the countries where they went to, it was even worse in Venezuela. So as a result of which remittances, of course, stopped. That was a factor. But these people, unfortunately, they found themselves not in home. They found themselves in a place where nobody wants to accept them. And even Maduro openly he claimed that these people are the ones bringing the virus in the country. To some extent, yes, but they were unfortunate in their own right. So the migrants have been worst hit, especially in a country like Venezuela. Yes, they have been worst hit because of the pandemic.
And what if we relate it to the indigenous group? As you said, the Bolivia, like we all know, there are lots of indigenous people are living. For example, in Peru, there are thousands of indigenous people. Like they don't speak Spanish. I think they speak other language. It's more like Guahatali.
Yeah.
So how it has like affected the COVID? Like COVID has affected them.
Again, historically, too, if you see, the indigenous people have always been at the receiving end. For instance, many of these constitutions, I worked on Peru actually in my MPhil in JNU. So the resources actually belong to the state, but the land is given to the indigenous people. It actually, there's a problem with that. So many times what happens, government, they might find resources underneath the land occupied by indigenous people, and then you have to relocate them. There are a lot of issues, and they don't want to go because, again, according to the indigenous culture, land is something like mother. Okay, literally they call it madre tierra or motherland. For them, it's like mother. And these indigenous people, yes, language wise, also in Peru and in other places, they have a problem because most of them don't speak Spanish, and they speak Quechua. In Paraguay, for instance, they speak Guarani. Okay, like that. So they have faced discrimination, and yes, they have faced a lot of problems. And even if you actually see the typecasting of the indigenous people, we tend to exotize them. I'm digressing a bit, but I'm just going to say we exotize them. That okay, in their costumes with their animals around them, we just try to exotize them. So countries like Bolivia, when they elected Evo Morales and all, it became a huge moral boost, okay, for the indigenous people. But again, because of this pandemic, what happened, since they've historically been sidelined, since historically they've faced all kind of issues, suddenly, they are the ones again the worst hit. First of all, they mostly depend on sale of very basic stuffs like forest products or simple agricultural products, for which they come from their villages or their reserved lands to the cities to sell these things. Now you have a lockdown, so they cannot come. So as a result of which they lose out on the income. One advantage which they initially had when is that they were isolated communities, so they did not face the virus, the issue of the virus that much. But again, that led to issues because then the healthcare personnel cannot also reach them. Then they cannot also come to cities to access healthcare. I mean, of course, it affected them. Then there's a huge problem. Genetically speaking, they are not that resistant to many diseases as normal people are. And historically, also, things like smallpox and measles have wiped out their population like anything. Like, for example, in 1950, the in Brazil, this tribe, the Kalapalo tribe, was completely wiped out due to measles. So those things, it passes like oral history from generations. So people know if the virus affects them, it will wipe out the entire community. So that threat is, of course, there. The second threat is how do you integrate them? These things should have been done long before. I mean, waiting for a pandemic to strike and then you come and contemplate how to integrate them, how to bring them to mainstream. These things should have been done long time before. Because even regarding vaccination, there could be biological issues that will they be able to take the vaccination? Will it not adversely affect them, considering the fact that they have mostly lived their lives very isolated? So yes, they are after the migrants, I believe, or maybe equal to the migrants, they are the worst hit. They will still face discrimination, they will still be sidelined, and there's a battle for resource in which they almost stand no chance given the huge historical disparity which they faced. That's there.
Yeah, like you said, very correctly. Like it has happened during the in Mexico. Although Benito Suarez he was the mulatto. He was like, but it doesn't help the indigenous people. The the government of Santa Ana, they just wiped it. Like
Yeah.
I think That's correct to say. So, moving on to our the last question, what is the future you can predict for the region for this year as the world is regaining the normalcy, but with lots of precautions?
Uh, but whatever may be the grim situation, Latin America always has a history of being very resilient in nature. I mean, they fought for independence with blood. They carved out their national identities, and it was not an easy thing to do. They have balance between during the Cold War. They balanced very smartly between the Soviet Union and the US. But yes, the pandemic has really affected them a lot. The first thing that they need to do is come out of their historical baggage, such as inequality, extreme poverty, inability to access healthcare, very low levels of education. They have all these parameters which has affected them. This is very difficult. I can predict a grim future. I don't want to say, but yes, the future is very grim because, as I said, they have nothing to fall back on. You have various sectors of economy. If one doesn't function, the others will at least hold it up. There, they don't have that. So, first of all, their overt dependence on foreign capital is a problem. But again, you can't avoid it because then how will you get your capital to finance projects? The second thing is countries like US, countries like India, us, even Southeast Asia, Japan, we need to, I won't say we need to, of course, help them in that way, but we need to build closer relations with them. When it comes to investment and all, when it comes to economic activities, we are far behind. India is far behind. In this case, I'd also like to say that it is very important for us Indian academicians to talk about this thing quite openly. Because when you see the way the Chinese work, out there because the Chinese are going to take advantage in a very predatory way. And as I openly say, this is nothing but a clandestine, a very covert and clandestine and very smart kind of a biowarfare that the Chinese have launched because their investments are not going down. In fact, they're buying of Brazilian electricity grids. They're buying of Peruvian electricity grids. Train Maya project in Mexico. They're doing all these things. So what does this indicate? This indicates that first of all, these Latin American countries are overtly dependent on China. Now, we can't tell them, see, please don't be dependent on China. China is a rogue state and they started the biological warfare. We need to step in, move up our investments in a better way so that we can compete. And yes, we need to compete. That's from our point of view. From their point of view, they need to be self-sufficient. When we liberalize the economy, we call for self-sufficiency. When Prime Minister Modi talks about Atmanirbhar Bharat, then he's also talking about self-sufficiency, which is important. I am not saying the economy should be inward looking. They are definitely inward looking as of now. There's no option. The second problem that happens is that there's an issue of vaccination. Now, certainly we can't expect them to, make their own vaccines overnight. They're trying. Costa Rica was a small country like Costa Rica is trying. It's amazing, and I really respect that country for that thing. But India has done its best. India should do also with the vaccination drive. For instance, the Chinese recently they tried to switch the allegiance of Paraguay. Paraguay is one of those countries in Latin America that recognizes Taiwan, not the People's Republic of China. So they tried to switch over the allegiance of Paraguay by saying we'll give you vaccines. India stepped in efficiently at the correct time, giving a bloody nose to the dragon, and actually ensured that this thing doesn't happen. Because economically, politically, and we have to also socially, economically, they need to be self-sufficient. Other countries need to move up their investment so that their economic parameters come into effect. First focus should be on generating employment because the physical capital has not been destroyed. It has just been laid off. So once you start generating employment, you start the small projects. As a result of which what happens, people get jobs, the shops are running, the basic functioning of the economy has to be kicked in. The second thing is that capital has to be provided with them with some less constraints. Of course, that region has a history of huge debt restructuring programs and all that thing. And even right now, there's a projection that the debt to GDP ratio has increased to 70 to 73%. That's very bad. But then the other countries have to do. We can't let this region slip away. The other thing that is very important is that when it comes to society, there's a problem with the drug cartels, very infamous problem. The Central American gangs. Now, these groups have to be dealt with. That is going to be a problem. And also, economically speaking, one has to reinvigorate the consumption, the basic demands, and the basic structure of the economy so that these basic functions work. The last and final thing that is very important is to diversify the economy. I think there is no way out. They depend a lot on these subsidies, and like Bolivia, you had the gas and water wars in 2009 because suddenly the states cannot keep up. You cannot subsidize everything. It is unfortunate to say, but they have to come out of this cyclic repression of subsidy. Then there's a loss of income. Again, you remove the subsidies. Again, you make some money out of selling something. Again, you start the subsidies. This has to come. Innovation, technological progress, adequate capital, proper investment in certain sectors, and a bit of privatization and public partnership. I think this will help. And smaller states like Costa Rica have led the way. They are a manufacturing country now. They do manufacture small things, even like medical equipments. Their tourism is very vibrant, which happens because they have taken advantage of something like the DR CAFTA, the regional integration method program with the United States of America. Because in any day, if these Latin American countries completely fall under the shadow of China, which is going to happen, unfortunately, then this will become even more worse because vassal of China should not be happy. That's what I would feel, right?
So thank you so much for your words, and I think that will be the best. Like this region needs to become more and more self-sufficient, so that this region does not fall to the China or to the US. And I think that will be the correct, because if we compare to the India and Latin America, like uh, although they are the same, but yeah, India is much more self-sufficient, and this region also needs to be more sufficient. And I think these are the very valuable points uh, that that I think they will remember. The this Latin American leadership will be taking care of that. So thank you so much for your words. So now